So many young people believe that some diseases are meant for old people. However, study shows that young people are also prone to diseases like diabetes, kidney, and high blood pressure. We have with us a Dr. Onyedikachi Chioma Nwakanma, who is a public health practitioner to discuss understanding diabetes, kidney disease, and high blood pressure in young people. Good morning, Madam. Are you there?
Yes, I'm here.
Good to have you on the show. So,
Thank you.
Especially in this season of COVID-19, where they keep telling us underlying illnesses make you even more susceptible to the virus. We've also been told that these three guys, the diabetes, kidney, and high blood pressure, are those are the underlying illnesses that COVID seemed to be very, very accustomed to, and that's why some of these cases can be very fatal. How do we detect these diseases in young people early enough?
Okay, here's what I'll say. Thank you for having me. So about these diseases you mentioned, hypertension, kidney disease, and diabetes, a lot of people feel that they are the disease of the old. And some people are worried that recently there's been a surge in the number of young people who are coming down with these diseases. However, what I like to say is that you can't discover what you're not searching for. And if you've not been investigating the young people, you won't really know. And these old people who come down with these diseases, most times, it doesn't mean it was during their old age that they actually got these diseases. So how we can be able to detect these things on time would be preventive healthcare screening. So in Nigeria, we don't have the culture of screening on a regular basis. You can't just see a Nigerian who just wakes up and decides, oh, I just want to go and check my BP or check my blood sugar, especially the young people who are just trying to make it in life. Okay, so I think one of the ways we can be able to, catch these things young and control them better would be, educating the masses, firstly, enlightenment, letting them know that, firstly, the young people can have these things, and secondly, letting them know what screening services they can go for, what tests they can go for, regular checkups like hypertension. I mean, every young person should know that every month, at least, you should check your blood pressure every month if you are not a known hypertensive. And same thing for the blood sugar, and for the kidney disease, the tricky part about these three things is that sometimes they don't really show symptoms on time until maybe it's getting too late. So at the end of the day, I would still say screening is and testing, regular testing and health checkups will be one of the effective ways we can be able to curb this in young people. Thank you.
Okay, if you're like me and you don't really like to go to the hospital, are there any symptoms that can tell you that your blood pressure is getting high, or you might be diabetic? Because I hate hospitals.
You are none of us.
Okay, so valid question. I mean, I'm a doctor, but I will tell you that I also don't like hospitals for myself.
Hello?
They might not necessarily want you going to the hospital, okay? They might not necessarily warrant you having your own blood pressure monitor in your house is okay. Why I'm saying this is that, as I said earlier, most of these diseases don't show symptoms on time until they're late. However, when they do show symptoms, I'll take hypertension firstly. When they show symptoms during the end stages, maybe when the person is already coming down with heart failure or, a particular hypertensive emergency, even stroke. I mean, young people can have stroke. So sometimes it doesn't really show symptoms. The complication just happens and people are like, where did this come from? Someone just slept and didn't wake up. Somebody was just talking and then his face shifted to one side. But then some of the signs that could show you symptoms could be maybe frequent headaches. People who are hypertensive or who are going towards that area, most times they have frequent headache, and sometimes it's not really warranted by anything, or maybe just mild exertion just makes you have constant headache. Sometimes it's not even relieved by analgesics. I mean, and then this can also be symptom for anything. So that's why I will still keep emphasizing screening. Then, I mean, breathlessness or mild exertion is also one of the symptoms of some hypertension or, long-standing hypertension. Breathlessness or mild exertion, example, when you want to climb the staircase, normally you climb the staircase without, losing your breath, but then climbing a few steps or just little exercise or little movement, and then you're breathless.
Right. Okay.
Yeah.
So I've
Okay.
read somewhere that there's a connection between diabetes and kidney diseases, that most people, when they discover they have diabetes, after using the drugs for a long time, it tends to lead to having kidney failure. What's the relationship, and how can a young person who is diabetic prevent it leading into a kidney issue?
Okay, thank you so much for this question. These three non-communicable diseases are interrelated. Diabetes can lead to kidney disease. Diabetes can also lead to hypertension. Even hypertension can also lead to kidney disease. Now, when it comes to diabetes, diabetes, prolonged diabetes, uncontrolled diabetes can affect the nerves. It can affect the blood vessels. Mostly is sugar being in the blood.
Uncontrolled.
Blood sugar, uncontrolled sugar in the blood. And then sometimes it can lead to narrowing of the blood vessels, and then blood flow to the kidney is reduced, Another thing could be for hypertension, when it's in the blood vessels, there's something we call atherosclerosis. So there's kind of thickening of the blood vessels. They become thicker, so they are no more as elastic as possible. So pressure in the blood vessels, that's high blood pressure, and it can also ultimately lead to hypertension. So for kidney disease, I would advise anyone who is diabetic to, seek help, go to the hospital, see a professional. Some people have had diabetes since they were born, and they've not come down with kidney complications. So the knowledge of, firstly, knowing that you can be at risk, knowing if you have a family history, going for screening and catching this thing on time can help you better control your diabetes or your hypertension. And once this is better controlled, I mean, they will always monitor your kidney functions too. So if there's any problem, even if you have any kidney disease, it can be found at the early stage and be well managed.
Okay.
So this would be the advice.
Right. Let me go on a quick break. When we come back, we'll continue this conversation with the doctor. Stay with us. We'll be right back. Thanks for staying with us. So we still have the doctor with us. YK, you had a question?
Huh?
Yes, obesity. YK, you were mentioning during the break.
Okay. Oh, sorry. Somebody very close to me is pre-diabetic, and he's not doing the things that he should do. Can you just, because he might be watching, help me give him advice on what to do? Because I think that exercise and then weight loss are the things. Can you just advise people who are pre-diabetic, and then what is pre-diabetic? Can you control it and not become diabetic?
Okay, thank you so much for that. I would start by saying that I know a lot of people on that table, who know what they should do, but they don't want to do it. So what I would say is, at some point, you need to realize that you are the one who is in charge of your health. You have to take charge of your health. And no matter how anybody tells you what to do and when or how to do it, until you get to the point where you decide that you want to be well for yourself, it won't work. So when it comes to controlling of diabetes or even pre-diabetes, as you rightly mentioned, now it's mostly when the blood sugar is within 126 gram per dl, and it hasn't tipped over. The normal is about 80 to 120. So whenever it's higher than that, then we're talking about diabetes. When it's prolonged and above 126 over time, then we're talking about diabetes. Now, for someone who is pre-diabetic, my advice would be, firstly, there's no management that you can do alone. It has to be collaborative between you and your doctor, your nutritionist, your fitness trainer, all that. So it's a collective thing. When it comes to management of diabetes, hypertension, and any of these conditions, dietary and lifestyle modifications need to be made. Now, when it comes to diet, we're seeing a high rise of these things because our diet is not as it used to be. During the time of my grandparents and great-grandparents, they were more conscious about what they were eating more vegetables and, good foods, whole meals, grains, and foods that are rich in fiber. It's not about saying don't eat this and don't eat that. When it comes to diabetes, we don't tell you don't eat. That's old practice. What we are more concerned about is portion control. And you have to, the way you can know what portion is good for you is, talking to a nutritionist or a dietitian who will help you formulate a meal plan that is for you. You can't use my own meal plan. You can't use the next excellence meal plan. And they find out foods around you, even the foods that you enjoy eating. Because most people shy away from this whole diet thing because they feel like, they're going to just tell me to be eating maybe a plantain or telling me to be eating something I don't enjoy.
Salad.
Making it boring. Yeah, thank you. Making food boring. But now, with new knowledge in medical science, we know, and nutrition science, we know that you can be able to eat, those things you love that are safe for you, but just eat them in a controlled portion, portion.
Fantastic.
So doing that is very, it's with lifestyle changes like exercise and, movement and not living a sedentary lifestyle. Those are very important weights.
Thank you. So I wanted to ask a question concerning people that have birth defects from birth, heart conditions that are not treatable, that you're meant to manage. How would such people who know that, okay, maybe I have a heart issue or I'm having leg issues, how can they now incorporate exercise and diet into preventing some of these sicknesses? Like, you have a heart condition, but you don't have hypertension yet. How can you ensure that your heart condition doesn't lead into you having hypertension?
Okay, someone who was diagnosed from birth, it means you already had some kind of medical support. I mean, the doctors have, you have a good, a close relationship with your doctor because, I mean, that's advice for you to have been diagnosed early. So your doctors will tell you what to do. Now, when it comes to exercise, the truth is, most people feel like exercise is stressful because of what they see on the internet. You want to push your limits, you just want to just stand up and carry one weight that is bigger than you. But then that's not what it is. And that's why I mentioned working with professionals. Not many people can afford this, but then there are also apps and different things right now in the digital world that can help, telling you what kind of exercise is good for you. Now, about helping yourself not to tip into hypertension, I would say there are different types of heart diseases. So I can't really speak specifically for all of them because of time. But I would say that for controlling, if you already know you have a tendency, in medicine, we say you have a risk factor for hypertension. Maybe it's even your family, someone in your family, or maybe your lifestyle. You just know that you are high risk for hypertension. I would advise that you modify. There are some things we call modifiable risk factors. Those ones you can change. You can't change your genetics. You can't change your family history. But then you can change behaviors like alcohol intake. Okay? You can drop that. It doesn't benefit you. Smoking, all those things increase your blood pressure. They also they're implicated in almost every non-communicable disease, talking about diabetes, hypertension, and even kidney disease. So firstly, alcohol and smoking.
Let's talk about alcohol for a second, Doc.
To you.
They tell us that alcohol can be measured, like you have the right quantity, it's okay. Do you still agree with that, or do you think we should just stop alcohol totally?
Okay, so I mean, for something that is not beneficial for you, some people will be like, they'll be like, alcohol, I need some alcohol, to function, the body needs alcohol. But here is the honest truth. I'll talk as a doctor, okay? So the honest truth is that this alcohol that you're talking about, your body, your body generates alcohol from even the carbohydrate foods that you eat, even as common as your bread. You can make the alcohol in it. But then some people, for social reasons want to drink and all that. That's understandable. If you are disciplined, because these things there's a point to get to, and then you become addicted to alcohol because it's a drug. So we advise that for people who insist on drinking, you should at least take a drink per day. A drink per day. Now, a drink is relative. It's about 12 ounces of beer, a 12-ounce bottle of beer, then is a shot. When you're talking about spirits, a shot, the shot glass, that's what it is. Then a glass of wine per day, that's totally okay, for you, for
Nothing
those who
more.
insist. But then I would advise that, since it's not beneficial to you, if you can avoid that, please avoid. It comes with a lot of risk, and you might just never know. You might think, I can control this, I can just take a drink per day, or, but then before you know it, it becomes another thing, especially in social drinking. Find out that you started abusing alcohol. So if you can, desist.
Fantastic. Thank you. I would have loved to press further, but there's some people that I care about that are listening to you, that hopefully they're getting the message. Thank you, Doc,
thank you so much
for this enlightened conversation. That's all we can take.
Thank you.
We've been speaking with Dr. Onyedikachi Chioma Nwakanma, who is a public health practitioner, discussing understanding diabetes, kidney and disease, and high blood pressure. That's all, ladies. Thank you very much. Hope you had enjoyed the show as much as we did.
very informative show.
Have a fabulous day.
Somebody tweeted that it's a very informative, educative show today.
Thank you. Thank
So-
you. So if you love to drink, please caution it, because some of us like to drink too. Have a fabulous day. We'll see you tomorrow. Bye for now.
We know that. Those that are shady, know ya.
You can watch Your View on TVC every Monday to Friday, 9 a.m. to 10:30 a.m. Nigerian time on DSTV channel 418, GOTV channel 27 and channel 47, StarTimes channel 121 and channel 307, Play TV channel 801 and channel 190, UHF 49, Sky channel 515 for UK viewers. Watch live on Facebook at TVC Connect and on our website tvcentertainment.tv/livestream.